Basically, it looks kind of like a retainer that fits over top of the teeth just for during the surgery. There's an access hole in that the drill for putting the implant fits directly into that, and it has a vertical stop, so we can't go too deep. We're not going to go too shallow. It's going to direct the drill exactly where we want it to go. Theoretically, we can close our eyes, put the drill into the hole, and it's going to be in the perfect spot. This is the series of photos, not x-rays at all, that's taken, and that basically is going to collect all the data needed to 3D print this drill guide. The implant surgery takes less time than the extraction of the tooth.
A lot of people treat a visit to a dentist as something that just has to be done, but it's not like something that they're looking forward to. So having that speed, accuracy, safety, all improved by a few percentage points, I think that's quite amazing. Today we're going to talk about dental implants. To be specific, guided implant surgery. We're going to talk about how technology is changing dentistry for the better. We're going to talk about really cool stuff. 3D scanning of patients' mouth. We're going to talk about 3D dental printing of dental crowns. We're going to talk about virtual design of this surgery and much more. I think it's very important because a lot of people are considering dental implants right now. And thanks to this technology, thanks to different advancement in healthcare, right now this surgery is better, easier, faster, and safer than ever before. I think you should know about this because it's important. It's important for clinical outcomes as well. Also, you know what we do in the group. And if you don't know, I'm going to tell you in a second, is I think it's also very important because oral health is an integral part of our overall health. And integrative healthcare is what we talk about in the doctors group all the time. So if you don't know much about Polish Your Life and what we do, we are a doctors group that actively searches for the best integrative health providers because there are many people who go from doctor to doctor. Sometimes they follow recommendations and they still don't feel better. I think this is not right. We got to do something about this. And integrative medicine is, in my opinion, the answer to this. So we are looking for the best providers, bringing them together to you, for you, because you have a chance for the best clinical outcomes. If you're up for this, follow us on social media at Polish Your Life. If you like this video, you find this helpful, please give it a like. Comment below if you have any questions to our guest. And also, if you're watching on YouTube, please consider subscribing because we have amazing guests like our guest today. I am here with Dr. Collin Steinweg, who is right here in Maryland at Clarksville Crossing Dental. And what's very special about him is he is actively bringing the future of dentistry to you. Dr. Steinweg, welcome to Polish Your Life.
Hi, good to be here.
Welcome, welcome. I was looking forward to this interview because people really need to know what I know right now about your office. It was very impressive when I first walked in, and I'm blown away because I'm always fascinated with how technology can improve healthcare. And walking to your office, you feel like you're like stepping into the future. So I want people to get to know you in that context, how you are actively bringing the future of dentistry to patients, researching what's out there. And tell us a little bit more about your passion and about yourself so they know who you are.
Absolutely. Well, thank you so much for your kind words about the office. I take a lot of pride in it. We started off as a very, very small 3-operatory office, and we were able to expand into a larger space, bring in some different types of equipment needed to do the things that we do. And I've been doing this for about 10 years, a little over 10 years actually. And I've seen just this paradigm shift in going from impressions and, kind of analog dentistry, drill and fill dentistry, to a lot more of a scientific, digitally driven workflow. And I've seen that, it's in the beginning, it can be kind of daunting for a lot of, practitioners that have been doing certain things for a long time. But this technology has been around since the 1980s. And in the last 10 years, it's just almost like a synergy. Everything is just coming together in such a way that it's very streamlined and extremely accurate, to the point where we're no longer doubting its efficacy. It's been around for so long and it's made such a tremendous impact on practices. And now it's had a chance to have tried and true outcomes, 10-year outcomes, 15-year outcomes. And we've been very happy with it, and it continues to improve.
Yeah, this is super exciting, and it makes everything easier, safer, and faster. And that's what patients need. That's what providers need as well. Let's talk about implants, because I know people, when they're watching, they will be very curious about different options and how it's done right now versus how was it done before. I know sometimes people have some misconceptions, and maybe they are afraid about implants, and maybe they are afraid for no reason in some cases. So let's talk about what guided implant surgery is, like how we do it right now, and also how does that differ from doing it the traditional conventional way and the clinical outcomes that come from that.
Okay, so I think probably a good place to start answering that is kind of debunking the whole, idea that implant surgery in itself is a very painful procedure. And I think that relatively speaking, compared to some of the other things that people have had done, like wisdom tooth extractions, any kind of extractions, root canals, things like that, relatively speaking, our patients say that these procedures for implants are actually a little easier to recover from. And it's just inherently, when you think of putting a dental implant in, you think of a screw going into your jawbone. The average person is going to think, that sounds really painful. I don't think I want to do
That
that.
really does.
And I just kind of want to debunk that a little bit, because when it comes to the basic anatomy of the jaw, there's not significant nerve in the bone itself. There are certain areas that do contain these kind of nerves that would sense pain and things like that, but we avoid those areas. We're able to take measurements. We measure again and again and again to confirm we're not going to be near anything like that. Now, especially with the technology now in 3D x-rays and things like that, we can feel even more confident that we're not going near anything important. So what patients experience is a little bit of, minor gum pain in the area. There are some cases where some different things have to be done, where it can be a couple of days of some discomfort that's managed with like over-the-counter pain medications and stuff. Now certainly there are some larger cases where there's like multiple implants being done, and that might be a little bit different. But like when it comes to, and we'll talk about that, but when it comes to like kind of like your everyday person that maybe lost one tooth and they need to have it replaced, it's not the scary procedure that you think. It's kind of like compared to, a lot of people are like, okay, well, dental needles, that's going to hurt because it's a needle in my gum. Oftentimes, like it's not nearly as bad as what people think when we do the proper kind of anesthetics, we take the proper techniques, things like that. But inherently in the brain, it's kind of hard to get that out of your head that this is going to be a painful procedure. It seems inherently painful. But what I'm here to do is kind of start off by saying it's not something you should be afraid of, especially if you've had some experiences that have been okay with other dental things like extractions and root canals and stuff.
This is so true, because we are always fearing the unknown. Like literally, I'm gonna turn off the lights and I'm alone with my, in my own home. But just the simple fact that I'm not seeing what's around me makes me a little bit more uneasy, because it's the unknown. And then you turn on the lights, it's the same room, and now suddenly it becomes a little bit more comfortable, which is only our perception. So sometimes for people who don't fully understand and maybe haven't gone through these procedures before, haven't witnessed any success stories, maybe they're a little bit more afraid, sometimes unnecessarily. And you're right. One thing is the objective, fear of something actually being damaged by the implant. Like for example, maybe my nerve is gonna get damaged, and what if? So that problem you're solving with the 3D technology that I wanted to ask you, how exactly does it work, that allows you to see exactly where the nerves are and what's the distance between the implant and the nerve, and then kind of like, doing a mini simulation of what's going to happen in the future, and first in the computer and then doing it on the patient. And then the second thing, like you mentioned, is the recovery time, the pain of the procedure itself, which is also fascinating because, as I'm learning from you, doing it with the guided strategy is allowing you to not have to like open everything up, to see where you're going, because you can kind of like see it before you do it. Let's talk about it, because it's two separate things that I think are both very important. The objective, problem that could happen that you solve with diagnostic testing, and then the type of procedure that you're doing that allows people to actually recover faster and not even be in that much pain during the procedure,
Exactly.
if at all, right?
Yeah, exactly. So if we've got some doctors watching and some, people that aren't in the medical field watching, we'll bring it down to just a perfect example. I hope I'm not losing anybody here with this type of game, because I feel like everybody played this game when they were a kid. It was called Operation. And it was a game where you drew a card and you had to take a piece of something out of a game board that was a human body, and you could not touch the sides of every little area where those pieces were hidden. If you touched the sides, the light would go off and you'd lose the game.
Mm-hmm.
You don't want to touch the sides. That's an important area. You don't want to touch that. If you touch that, you lose the game. His nose would light up and you would lose a turn. So hopefully I'm not losing anybody. You should Google it if you haven't heard of Operation. But like what I'm going to say is, like, you don't want to touch these important structures. Okay. And there's some definitely very important structures in the jawbone and, just in the head and neck in general, some really important things that we don't want to hit. So back in the old days of doing dental implant surgeries, we had to completely open up the surgical area, so we could see every single little thing. And even after that, even for the most skilled of surgeons, we had to not touch the sides. We had to not hit the area that wasn't important. So imagine you're the operator and you're the one actually putting an implant into a space, essentially blind, but you have the experience behind it, but you're essentially just kind of, my aim is true, and you're placing an implant. And, even for the most skilled of surgeons, they'd look at that and they'd say, okay, that was pretty good. I really like how that turned out, but I wish it was a little bit over here. But it's acceptable. It's okay. The patient's not going to have any problem. There's going to be no damage, things like that. So that's how it typically had to be done. There were multiple stitches involved with the surgery, things like that. So that's how it started out. And that's how it's been done for about 30 years or so. Implants have been done for probably almost 40 years at this point.
Wow.
So that's how it was always done. And then they would rely on two-dimensional x-rays, which are not accurate for size. You can't judge size, because based off of the angle of how the x-ray is taken, it's just an estimation. It's not a measurement or anything like that. So then when CT scans had come out, that's basically a 3D x-ray. Okay, that's the first step in getting that information. Okay, but we still don't know how to actually replicate that in the patient. We can take measurements all day. We can look and remeasure, but we're still guessing. When we go to place the implant, we're doing our best educated guess as to where the implant should go. Okay, so that's just kind of like a little synopsis of how it's been done up until now. And, there are still some very skilled surgeons that don't use guided implant surgery, but it's if you can control every aspect of where that implant is placed within a 1/4 millimeter, say, of accuracy.
Wow.
Why wouldn't you do that?
It makes total sense.
Why wouldn't
So
you do that?
why would people, I'm just curious, why would some people do it the old school way or the traditional way while this new method is already available? Why some doctors already do it? Is it the cost? Is it the skill? Is it the training? Is it equipment?
I think it's the equivalent of driving a manual car versus an automatic car. Some people really are just a fan of the manual. They've been doing it for so long. And then you try to hand them an automatic car and they're not interested in it at all, even though it's so much easier. It's so much straightforward. You can sip your coffee, you can, do makeup or whatever, but you can't do that with a manual car. You've got to have both hands in it. So I would say that, the people who are still doing it not guided, that's not that they're being negligent or they're doing a lower standard of care or anything like that. So I don't want to insinuate that,
Hmm.
There's a lot of surgeons that are so absolutely skilled that they can have a tremendous amount of accuracy in how they're placing things. But, it's also more streamlined for the patient, so it's not the skill level, but, as you're placing the implant, the procedure is shorter. Patients like shorter procedures, especially if they're awake and not sedated. So, there's not a lot of, you're asking like, why wouldn't they use that? They probably have their own personal reasons and just in their experience, they just like to do it their way. But for a person who wants to have their appointment as, short and also accurate and lower risk,
Hmm.
definitely do it this way with the guided surgery.
Makes total sense. And now that you're explaining this, thank you for giving me that answer, because I really didn't know what is the major block. And now, as you're saying this with manual versus automatic, sometimes it's personal preference, sometimes there is logic behind it, sometimes not always there is logic behind it. But also, there's another thing about us human beings overall is that all of us, we are kind of resistant to change because we are so used to doing things a specific way. And
Yeah.
even if you change it for the better, just the simple fact that it's new, you don't feel that confident as doing it the old way. So, like, for example, I was driving manual in Europe, no problem. And then I go to automatic. While it's easier, while it's, I think personally, better, that first moment was a moment of uneasiness. Like, am I gonna press this, brake pedal instead of the clutch? It's like, I don't know, because I'm just not used to it. So I'm trying to imagine and also understand some dentists who will choose to continue to do it traditional way. And with everything you're explaining, that's very, very interesting, because it makes 100% sense. So guide me, if you don't mind, I'm talking about guided surgery,
Yeah.
guide me through that process. So the patient comes in, what is the process? Number one, number two, like what actually happens? What is that guided surgery, if you don't mind? Just explain.
Yeah, sure, absolutely. So the guided surgery is essentially it's a for any engineers or anybody who does working out woodworking, it would be a drill jig. Okay, and that would probably ring a bell for a lot of people who are like in the engineering thing. For people who aren't in that kind of field, basically it looks kind of like a retainer, and we'll show you some pictures of this that fits over top of the teeth just for during the surgery. There's an access hole in that the drill for putting the implant fits directly into that, and it has a vertical stop, so we can't go too deep. We're not going to go too shallow. It's going to direct the drill exactly where we want it to go. So theoretically, not that we would do this, but theoretically, we can close our eyes, put the drill into the hole, and it's going to be in the perfect spot. So basically,
Wow.
it's a removable appliance that's used just during the surgery to guide the placement of the implant into its exact spot. So in order to be able to create this, we have to 3D print it. So in order to do that, we have to capture an impression of the patient's mouth, basically a mold of their mouth. Now, this is done digitally now. It's not done with the dough that makes you want to gag, where they put the giant wad of stuff in there and you have to wait several minutes
My
and
favorite.
sweat and panic while it's sitting in there. This is the series of photos, not x-rays at all, that's taken. And that basically is going to collect all the data needed to 3D print this drill guide. Now, we have to overlay that with a 3D x-ray. So we're going to do the scan quickly of the patient's mouth, takes about 45 seconds. And then we have them go into the x-ray machine and they just stand there, and the unit goes around their head for about 30 seconds. And then we have all the data that we need to sit at the computer and design the surgery while the patient's at home. So they don't have to sit there. Their first appointment's a 10-minute pre-op where we discuss, we hash out any questions or any concerns about pain or any concerns about the procedure, make sure all the questions are answered before they come in for the day. And then the surgeries on average, they're only about 20 minutes. I've had just a few where I still kind of want to visualize anyway. I still use the guide to place the implant where I want, but sometimes I won't go into too much detail about this, but sometimes we just want to visualize the tissues in the surrounding area. So we do still do a couple of small stitches that will fall out, they'll dissolve. It's not like they have to be removed later on. While the patients are numb, sometimes we have to kind of explore that area a little bit. some of the cases. I'd say maybe 1 out of 10, we have to do
Oh, so
that.
just okay,
It's
okay,
not
so just
often.
10%.
It's not often, but I will always tell the patient when I'm planning on doing that. Not that it really affects their post-operative that much, but that's how it's done. So, the patients come in, we numb them up, and it's faster than most extractions. Number one, I
Wow.
do a lot of extractions for a general dentist, and the implant surgery takes less time than the extraction of the tooth.
Do you have people surprised, like like getting up after the surgery and they're like, that's it?
When they look at the x-ray and they see the implant sitting there, they can't believe that it's them, and that was done that quickly. Especially they had probably had a tooth extracted before, and you do remember patients never forget how it felt like it was forever. There was some tugging, there was some pressure, it was uncomfortable, things like that. And then they have this, and they're just blown away with how simple it is. And then post-operatively, I really don't get many calls. I really don't get many calls at all. I see a patient a month later and they'll say,
Hmm.
yeah, it's fine. You know,
Wow.
I'll get calls with extractions sometimes over the weekend that they're having some soreness and things, but I really rarely get calls, post-operative calls, with concerns.
This is so awesome. It's great for patients, much easier for providers. And what I want to touch on is also how this is an integral part of our healthcare, like the overall health, to make sure that our oral health is, the highest possible standard. Because there are many ways that gum disease, bone loss, not only cosmetically can affect you, but also systemically can be a big problem. So if you could just give us a little bit of an overview without going too deep of some key benefits of having an implant, for example, versus a bridge or versus just leaving it alone.
Right, exactly. So when we miss a tooth, when we lose a tooth, there can be a couple things that happen with the drifting and shifting of the teeth around the area. Teeth tend to move around until they hit a force that's equal or opposite to the one they're creating. So basically, like if we have a tooth missing, the neighboring teeth are going to do this into the space. They're going to just kind of fall into the space where the tooth was missing. That can create some issues with food packing, periodontal disease, cavities, things like that. So, and if we form like any issues like periodontal disease or anything like that, that's been linked to diabetes, being poorly controlled, things like that. They affect each other. So we really want the teeth to be as healthy as possible. There's some ways to mitigate that aren't dental implants, like you mentioned, the bridge option, things like that. Some of my patients that, as much as I talk to them and I try to discuss the benefits of implants, I'm not going to force anybody to do anything. So I give them the option to do bridge work. And it's something that's been done for a really long time, Egyptian times, where, we'll cement a tooth into the space using the neighboring teeth as kind of like a structure to hold that tooth in there. Most of the time we're preparing the neighboring teeth for crowns. So we'll kind of cement something in there permanently. That doesn't have as good of a periodontal health. It's harder to maintain the hygiene with that. And it also can have some failures at 10 years due to cavities or stuff like that on the crowns. So, it's definitely not as good as a dental implant. But in some cases, we still do it. And, the patients are happy and they don't want to do, the surgery, and they're fine with the bridge. A lot of the time they don't know that, how good it would be to just have a single implant because they just went with the bridge
Mhm.
anyway. But we want to kind of debunk these things so that patients feel comfortable and they can get the best treatment,
Yes.
the best option, which is going to be the dental implant.
This is also very good to know for people because we look at sometimes the outlook is next year, 2 years, 3 years. But when we talk about decades, like let's say somebody's 30 and they need that implant to be there for the rest of their life, when you look at the success rate for the next from 30, let's say somebody lives to 100, for the next 70 years, the likelihood of a bridge needing to be replaced is pretty high comparing to an implant, correct?
Oh yes, they've looked at the lifespan of teeth. That's something they've studied for a really long time. Like, have teeth received dental treatment and where they've ended up in, 30, 40 years after that. And they found that if a tooth has to even have a simple filling done to it, that if you the risk of that tooth being lost is like, I think 6 or 7 times higher by the end of life
From a simple filling,
on the
not even a
simple
crown.
filling, because those things always require maintenance.
Mm.
A filling might be a larger filling 10 years later. That might be a
Hmm.
crown 10 years later after that, things like that.
And statistically
So
becomes more
statistically,
risky.
it's much higher. Now there's certainly the statistics are higher, but you can still maintain your teeth after they have dental work done. So, I also don't want to insinuate that you're eventually going to lose your teeth if you get dental
Hmm.
work done, but the odds of you losing them does go up higher the more dental work you receive over time, because it all requires maintenance, right? So we have to think about the maintenance. Now, if I have a 90-year-old person that's lost their front tooth, I would most certainly do a bridge for them.
Hmm.
I would most certainly do a bridge for them. There's no hands down. I mean, we consider people's situations, and we definitely consider our patients. It's not a one size fits all treatment plan
Hmm.
by
Of
any
course.
means.
Same with
Um,
kids, right? Because they need to be fully, like the jaw needs to be fully developed for the implant to be placed. Is that
yeah,
right?
exactly. So we would definitely wait and maybe do some orthodontic treatment and wait until they're
Hmm.
older, about 19, 20 years old, before we would do any kind of implant work.
Okay, okay. So there's still a good window of age that we can lean towards implants, but there are some cases where you would either do a bridge or wait a little bit, and that makes sense.
Yeah.
There's, really a lot of different questions that I have right now and topics that we can go into in maybe future videos or questions people can ask you specifically. I'm thinking about bone reconstruction, multiple implant surgeries, and other things that are super fascinating. Like, for example, the 3D printing. Actually, let's talk about 3D printing, if you don't mind, when it comes to restoration, because that's something that, like, when I actually saw this being like done in front of me, you feel like it's the future is here, and you're like, I thought this is a concept, and you're like, no, it's like in that other room. Check it out.
Yeah.
So let's talk about this, and let's talk about quickly the benefits of this and how it actually works.
Yeah, no. So making crowns, we call it milling. Usually for just like for it makes more sense to think of printing, but basically we take down a piece of stock material and it's being ground down by a machine to be the perfect fit on a crown margin. So basically the seal that we create as the dentist when we're doing, say, like a crown or a veneer or something like that. This machine is providing us with a perfect margin where it's going to be matching against the tooth there. And the digital technology has given us the ability to control a bunch of parameters, specific parameters. Whereas before, it was all done by hand. And yeah, there are definitely some very skilled lab techs out there. They would do an amazing job on that. But it takes a long time to get that kind of skill where these crowns would be able to be not heavily adjusted, contoured properly, things like that. When we kind of harness the digital technology, we have the ability to actually go on the computer and say, I want this much pressure in this spot. I want this much pressure on that spot. And you can actually control specific parameters. And, again, back to kind of like the way the guided surgery is a more controlled situation. So is with the digital design. We can eliminate a lot of the ability to be making the educated guesses and things like that. We literally can click it and say we want it to be this much pressure in this much of a spot. So there's no subjectivity, at all. So once I design these things on the laptop and I bring the patient in, um, there is a lot less adjustment needed. I mean, the crowns just drop right into place. Floss is perfect, bites perfect. Now there are some times where I have to take some time to adjust and still fine tune, but we have such a better starting spot because of that. So again, back to the shorter appointments, shorter appointments in the chair. If we can be more accurate with the restorations, patients are happier.
Oh my goodness, so powerful. Shorter appointments, less of them needed. And while I respect dentistry, I respect dentists, it's hard work. At the same time, a lot of people treat a visit to a dentist as something that just has to be done, but it's not like something that they're looking forward to. So having that speed, accuracy, safety, all improved by a few percentage points, I think that's quite amazing.
Yeah, and I feel for patients. I don't want them sitting there for an hour and a half for something that should have been 10 minutes. I feel like if I were in their position and I had anxiety, you know, each minute that passes by for some people, the anxiety is tick, 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 tick. It
Hmm.
builds, especially if they have like an anxiety disorder, you know, if they actually have that. And I have a fair amount of patients that have that. It's a very common disorder, anxiety and depression, very, very common. So when a patient's in a chair doing something they don't really want to do, but they know they have to do, and they have this disorder, I assume that everybody has it. I just assume because you never know. Some people have it and they're not very outward about it. So yeah, I could sit there all day and talk to them about, oh, how's this going? What are your summer plans? But in their heart and their mind, their anxiety is building, and I feel for them. I've worked aside dentists before. And again, nothing against other practitioners. Some people like to talk to their patients about this and that and make the appointment really lengthy and stuff like that. But I like to be just efficient, get everything done. And then once the patient stands up, then I can talk to them about where they want to
So
go,
important.
what they want to do, with their summer, this, that, and the third. Because I sense in my mind that their anxiety could be building, even though they're not telling me, even though they might seem completely like stoic, fine. You never know what's going
You
on in
never
here.
know. You never
So
know. And most dentists won't do what you're doing. Seriously, they won't, because not everybody has this level of empathy, and just assuming that somebody could have anxiety, um, it's quite amazing, because you're making it less painful, faster, safer, quicker. And like you said, if they want to talk after they stand up, of course, I know you. Is like you're very friendly. At the same time, you don't want to make them more uncomfortable by forcing them to try to be comfortable, because it's counterproductive.
because it's counterproductive, especially and honestly, like if any doctors or any dentists watching, you have to agree that it's always the patients that say, hey doc, I'm a baby, just so you know, like I'm a real baby, and I want to get this done as soon as possible because I'm just such a baby. Those patients are never the ones that you have to be worried about. Those ones are the ones that are completely fine. They have no, I mean, they might be a little bit, yeah, but it's the ones that are quiet and the ones
Hmm.
that are sitting there like this. And
Hmm.
the ones that are, just, they might kind of be like, yeah, I'm doing fine. How are you? Like those are the ones that inside their anxiety is through the roof, through the roof. It's the ones that are willing to admit it to you that usually aren't really that bad, you know? So that
So
being
fascinating.
said, you have to think about it. It could be anybody. It could be literally anybody sitting in your chair. Their anxiety could be going up, 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 up,
Hmm.
up,
It
up.
could be the
And
mean guy. It could be the friendly guy, the quiet guy, or
yeah,
quiet woman. Unbelievable that on the other side, because this is kind of like, as a patient, that's what you would dream to expect, is the provider thinking about you as a patient from multiple different layers, right? So there is the dental procedure that needs to happen, but there's also a little bit of understanding of the psychology of the situation and some fears. And it's very good to know that you look at the patient from multiple different angles and look from the patient's perspective, even assuming that they could be anxious.
yeah.
What's there's one question that is in my mind, since you are researching what's coming up, and then some of these things I already see in your office. Some of these things I know you're thinking about. So what's coming up in dentistry that gets you excited that you don't have yet?
Yeah, no. So something that I don't have yet, but is coming out now is, so we talked about 3D milling, and we kind of throw around the 3D printing term. And I mean, that's just terminology. It doesn't matter. But like specifically what we're doing now is we're cutting down a piece of material to make it into a crown. Okay. And then when we're making like a drill guide, we're actually building material in a resin material. So we're going from nothing to something with 3D printing. And with milling, we're taking something and then we're cutting it down to something else. Okay. So where we're going with crowns and this has just recently been FDA approved, 501(k) cleared, is 3D printing of crowns. So basically, we're taking a kind of like a resin tank or something like that, and we're building on top layers and layers and layers to build a crown. Now that's really fascinating to me. The 3D printing has come that far that it can be that accurate. Normally with the milling, we think of that as more accurate because it can be milled with a drill bit to a specific shape. But 3D printing, it kind of was one of those things where like it's accurate, but is it to the micrometer? Is it down to the, the high strength microscope level tight of a contact between two things, restoration and tooth? So 3D printing is now coming out with crown materials that are designed to be permanent crowns. They've had temporary crowns for a couple of years, but now they have a ceramic that's printable, which is fascinating. Now, I'm gonna wait, I think, a little bit on that before I start doing that. I kind of want to see how, because that's brand new. So this time right now with that is kind of like milling in the 80s. So I'm kind of gonna wait a little bit on that before I start using that kind of technology to print a crown.
I think that's very smart, and it is so fascinating because it's coming, and just like any technology at the beginning, while the concept and the promise behind it is amazing, there needs to be a little bit of time to work out the kinks. Let's put it this way: to see it in action, to have enough clinical studies to see the benefits compared with the risks and the problems, and the fine tuning that is sometimes needed. So I think waiting for this is definitely a good strategy. It's good that you are on the lookout and you have your eye on it, and I think everybody's going to benefit from that. So it's really my pleasure to introduce you to our network of doctors, and I want everybody thinking about their patients right now. If it's you and you're a doctor watching, and maybe you know that systemically there is something wrong with the patient, and you're suspecting that there could be something with their oral health that could be improved, having all this technology, implants included, guided implant surgery included, that's something that could be a very good tool. And especially if you're in Maryland and you would like to collaborate together with Dr. Steinweg, just consider connecting. How can people find you, Dr. Steinweg?
Yeah, no, they can call my office out in Clarksville. We're open 4 days a week, Monday through Thursday and some Fridays. So they can call me there, or they can email my office. They can, let's see, the best way. I think just calling the front desk, getting in touch with me that way, or if you could comment in like on our YouTube channel or something like that, I could reach out to you that way. But yeah, no, it's so important to collaborate with regular doctors and other specialties, because of how linked the teeth are, and the gum health and the bone health is to the rest of the body. We won't place an implant on somebody with uncontrolled diabetes, for instance. High failure rate. So we're not doing the patient any favors if we just do something for them without checking with their doctor first, or if they haven't had a checkup in a long time and they say something like, "Oh, I used to be diabetic," and you look at them and you just ask them, when was the last time you were in the doctor? And they say, "Oh, 10 years ago, I used to be diabetic. I don't think I'm diabetic anymore." They say things like this. There's patients who don't say they have diabetes, and I'll look at their medication list and there's diabetic drugs on there. So we want to make sure that we get the medical consult done with anybody we even suspect has those kind of issues or miscommunications, and that the bone health is good too. So women over 50, make sure their bone health is good, make sure that they get tested for that, get screened for that if anything like that's suspected. So we have a lot of medical consults that we do just to make sure that things are going to go well and they're not going to be unnecessary complications. So yeah, it's important to keep the lines of communication.
Yes, and I love it because in integrative healthcare, we talk about communication being key. They need to communicate with you. I'm talking about other providers. You communicate with them. And in this case, everybody wins because you're not going blindly, not only with what you see in the mouth and then the bones, beyond, whatever the scan is going to be able to show you. But on top of that, looking at the overall health from the intake form, but now you can also communicate with other providers, make sure everything is safe, that this is in fact the best strategy. And this is the beauty of the future of healthcare overall, is that it is all, just like the body is all interconnected, healthcare should be interconnected. I believe it's too separate, and this is the biggest problem that people have, and they are getting frustrated. They're going from a specialist to a specialist. Sometimes they really follow all the recommendations, and imagine if you're still not getting better, sometimes you're getting worse, then what? So very happy to have you in our group. I'm proud to introduce you to our people, and we haven't even talked to you about all the other things that are happening at Dr. Steinweg's office, like his sleep apnea solutions and other things that are helping overall health, in addition to just the guided dental implant surgery we kind of put our focus on today. So thank you so much, Dr. Steinweg, and thank you so much for watching. I really appreciate all of you. And if you're watching for the first time and maybe you're not subscribed to our YouTube channel, consider subscribing, because you will have amazing providers there, and we are all here to help each other. All the best.
Thanks so much.
Thank you. Bye.